discussion about research article that was out in June this year, and they took about 700 people and were looking at um, the beliefs of these patients with regards to exercise therapy is going to be helpful for their low back pain, or surgery is going to be helpful for their low back pain, and they broke these groups up and what they into folks that had high expectations for exercise to help them. People had low expectations. People had high expectations for surgery to help them. People had low expectations, and so forth. And unfortunately, and this is a failure of kind of more the musculoskeletal healthcare providers and getting information out there, and just kind of people in general who are willing to participate in physical activity. But they found that in the group, just as a whole, only 33% of the people in the whole group even had confidence that exercise could help their back pain. And that kind of tracks along with the percentage of people out there that probably engage in some sort of physical activity. So if you plotted those things together, you'd probably notice that people that already engage in physical activity probably have a higher likelihood of being confident that exercise is going to help them with their back pain. Okay. And that bared out those 33% of people that said, yes, I have high expectations for exercise to help me with my back pain, had the best outcomes in functionality and pain reduction at 6 weeks, at 6 months when they rechecked these people. And the people that had high expectations for surgery, there's about 11% of these 700 had very high expectations that a surgical intervention would help their back pain. They didn't have any significant changes compared to others in their pain and function at 6 weeks and 6 months. So, those groups of people that figured someone else will fix this for me and I'll be better, compared to those groups of people that are taking ownership and accountability for their situation and putting in the work and taking care of some other things with probably their lifestyle, behavior, choices, things like that that are going to help drive them. Because it's not just exercise, and exercise helps people for a variety of reasons. But just the fact that these folks, one, came in saying exercise will help my back pain, I have high confidence. And then on top of that, those people followed through with those conservative management plans and had the best outcomes. Whereas the people that said, exercise is not going to be helpful, I have high confidence that surgery will help my back, because those groups are probably less likely to engage in behaviors, choices, activities that in their life that are going to drive those adaptations to make them better. And they're just sitting there going, my back hurts, surgeon will fix my back pain will be gone. But those folks end up being very disappointed when they come to find out that and that's a very poor strategy for recovering or for improving back pain, is relying on somebody else to do it for you. So I'm not saying that surgery is never necessary, and I'm not saying that exercise helps everyone. What I'm saying is people's beliefs about exercise and its ability to help them leading into the training and leading into the rehabilitation planning had by far the best outcomes. People who believed surgery would help them did not have good outcomes. So it's just very interesting in that when you look at things like that, that surgery is not going to give you the good outcome that you were hoping for, even if you believe it was going to help. And then you end up with this mismatch at the end. Whereas I'm willing to do the work, I understand that I can help myself, and I'm going to follow through with the exercise plan that I am confident is going to help me, you're going to be way better off. So think about that. Check my channel for more. See you next time.